My name is Richard Carvajal. I'm a medical oncologist from Columbia University Medical Center, where I'm an associate professor of medicine, focusing on ocular oncology and drug development for patients with metastatic eye cancer. So this year at ARVO in Honolulu, I'm presenting data on a drug called IMC-GP100 in patients with metastatic ocular melanoma. Just in the way of background, ocular melanoma, uveal melanoma is a rare disease. We see about 2,500 cases a year in the U.S. Importantly, uveal melanoma is biologically, clinically distinct from its cutaneous counterpart. Importantly, when cutaneous melanoma metastasizes, we now have effective targeted therapies and immunotherapies to treat those patients. For uveal melanoma, those treatments are absolutely ineffective. And unfortunately, despite decades of research, for patients with metastatic ocular melanoma, we still do not have any effective ways to treat those patients. IMC-GP100 represents really an incredibly promising therapy for this group of patients. This is a drug, just a little bit of mechanism, that it's a bispecific molecule that on one half binds to something called GP100, which is heavily expressed on uveal melanoma cells, and on the other side just binds to something called CD3, present on immune cells. So it's a type of immunotherapy that just brings the immune cells right next to the cancer cell. And by doing that, we're seeing dramatic cell death. When we look historically at the patients with metastatic uveal melanoma, median survival is under a year. We've done big retrospective studies where, at a year, about at best 40 to 45% of patients are alive. And with this drug, we're seeing one-year survival rates over 70% in very preliminary data, but certainly this is data and results that we have not seen with other agents. From an optometrist perspective, I think what's really important to note is that there is hope for patients. I think it's highly critical that people are aware of this disease, so it's diagnosed early, that patients with the disease are referred as quickly as possible to the ocular oncologists for primary treatment. And if the cancer comes back, they should be referred to medical oncologists focusing on this disease. I think the research that's being done in this field is unprecedented. The data, the understanding of the biology is really developing at a rate that we have not seen in this disease ever. Immunocore, this IMC-GP100 drug, is showing tremendous promise. Not just in patients with metastatic disease, but this is something that we do plan to bring forward for patients at high risk of disease recurrence to help prevent it from ever metastasizing.